Have you ever felt something like this? You stand up from a chair and there's a small pinch in your knee. You walk down the stairs and feel a light pressure that wasn't there before. You twist your body to reach for something and notice a little ache that disappears as quickly as it came. A lot of people brush these moments off because the pain is mild and easy to ignore. But I want you to stay with me, because these small signals are far more important than most people realize. One of my patients once told me, "It started as just a tiny discomfort. Now I have to hold the railing every time I take the stairs." When she said that, she wasn't just describing pain. She was describing a journey that many seniors go through without even noticing. Pain rarely arrives suddenly. It whispers long before it shouts. And mild joint pain is often the very first whisper. Now I want you to imagine this. Inside your joints, long before the pain becomes intense, small changes are already happening. The cartilage that protects your bones begins to thin. The lubricating fluid inside the joint starts to decrease. The surrounding muscles become weaker with age. A low level of inflammation quietly builds. You may not feel much at first, but your body is trying to tell you that something needs attention. This is why mild joint pain is never just mild. It's the earliest warning sign that the joint is under stress, that something is wearing down or losing balance. Many seniors don't realize that the mild phase is actually the golden window where healing and prevention work best. Once the pain becomes moderate or severe, the damage has already advanced. In the next part of this video, we're going to explore exactly what happens inside your joints, why mild pain progresses faster than you think, when it becomes dangerous, and what simple steps you can take to protect your mobility for years to come. And trust me, with the right attention and gentle care, your joints can still recover and stay strong. If you find this helpful, make sure to subscribe and follow Senior Health Daily so we can continue this journey together. Your body is speaking. I'm here to help you understand what it's saying. What mild joint pain really is. When people hear the phrase mild joint pain, they often imagine something trivial. A little ache, a bit of stiffness, nothing worth worrying about. But from a medical perspective, mild joint pain is often the very first sign that your joints are under stress and beginning to change on the inside. Inside every healthy joint, there is a layer of smooth cartilage that cushions your bones and helps them glide past each other easily. There is also a small amount of fluid that works like oil inside an engine, keeping everything moving comfortably. When you feel mild joint pain, it usually means something in that system is already being disturbed. The cartilage might be starting to thin. The fluid may not be circulating as well as it used to. The muscles and ligaments around the joint may be losing strength and control. Think of it like hearing a faint rattle under the hood of a car you have driven for many years. The car still runs. It still gets you where you need to go. But that small sound is not there by accident. It is the engine's way of telling you that something needs attention. Mild joint pain is your body's version of that gentle warning. It is not there to scare you. It is there to invite you to act before the situation becomes serious. From my years of listening to patients, I know that many older adults dismiss mild pain because it comes and goes. One day the knee hurts, the next day it feels almost normal. That inconsistency tricks people into thinking nothing important is happening. But in reality, the joint tissue does not heal fully between those episodes. The strain adds up very quietly over weeks, months, and years. So when you notice mild joint pain, even if it seems small, remember this. Your body is not being dramatic. It is communicating. It is telling you that your joints are working harder than they should, and that this is the perfect time to protect them. Why mild pain can become dangerous quickly. You might wonder how something that starts so small can turn into something big. How does a tiny ache evolve into pain that changes the way you walk, climb stairs, or live your daily life? One of the main reasons is low-level inflammation. This is not the intense kind of inflammation you feel with a sprain or an infection. It is quieter, slower, and often painless at first, but it still does damage. Inflammation releases chemicals inside the joint that slowly weaken cartilage and irritate the lining of the joint. Even if your pain stays mild, this process may still be progressing underneath the surface. Over time, the cartilage that protects the ends of the bones becomes thinner and rougher. You may not feel a lot at first, maybe just a twinge when you go down the stairs or stand up too quickly. But each time you load that joint, especially if your muscles are not strong enough to help, the worn cartilage struggles to do its job. The joint becomes less forgiving. Movements that were once easy start to feel awkward or uncomfortable. The muscles around the joint also play a key role in this story. As we age, muscle mass naturally decreases. If we are not actively working to keep our muscles strong, they become weak, especially around the hips, thighs, and core. When those muscles do not support the joint itself becomes the main shock absorber. That means more pressure with every step, more strain with every movement, and faster progression from mild pain to significant damage. Joint alignment matters too. Many seniors have small postural habits they are not aware of. Maybe the knees angle inward a bit when standing. Maybe one leg carries more weight. Maybe the feet roll inward when walking. These subtle shifts increase pressure on specific parts of the joint and can turn a small problem into a bigger one more quickly than you might expect. I remember a patient who came to see me after about 3 months of mild knee discomfort. At first, it only bothered him when he went down the stairs. He decided to ignore it and simply avoid using the stairs when he could. A year later, he returned, not because the pain was still mild, but because it had become sharp and constant. His knee felt stiff every morning. He heard grinding when he moved it. An X-ray showed clear signs of cartilage loss. The mild phase had been his opportunity to intervene. Instead, it became the chapter he skipped, and the story moved on without his consent. That is how mild joint pain becomes dangerous. Not because it is loud, but because it is quiet. Because it invites delay. Because it feels small right up until the day it no longer is. Early signs that mild pain is becoming serious. So how can you tell when mild joint pain is shifting into something more concerning? The body offers very specific clues, especially in older adults. The key is to notice them and take them seriously. One of the most important early signs is pain when you stand up after sitting. If your knees or hips send a little jolt of pain every time you rise, that is not just stiffness. It is a sign that the joint structures are struggling with the change from rest to weight-bearing. Another clue is pain when you walk downstairs or down a slope. Going down is harder on the joints than going up, because it requires more control and braking from the muscles. If that movement becomes uncomfortable, it often means the muscles and cartilage are no longer sharing the work evenly. You might also notice pain that starts in one area and seems to spread. Mild knee pain may begin to radiate into the thigh, hip, or calf. Mild hip pain may travel into the groin or the side of the leg. This spreading pattern can indicate that other tissues are being dragged into the problem, either through irritation or compensation. Some seniors hear or feel a persistent clicking, popping, or grinding in a joint that also hurts. Occasional sounds are normal, but when the noise is paired with discomfort and stiffness, it often reflects changes in the surfaces or supporting tissues of the joint. Gentle swelling at the end of the day is another subtle warning. Even if the swelling is not dramatic, that fullness signals irritation inside the joint. Then there is the matter of balance and confidence. If your steps become shorter without you meaning to shorten them, if you feel unsure walking on uneven ground, or if you find yourself scanning for walls or furniture to hold on to just in case, your body is telling you that your joints and muscles do not feel as reliable as they used to. I often tell my patients that these signs are not normal aging. They are common, yes, but that does not make them harmless. Common and normal are not the same. These changes are your body's way of raising its hand and saying, "I need a little help here." Why older adults progress faster from mild to severe pain? You might ask yourself, why does this seem to happen faster now than when I was younger? The answer lies in how the aging body changes over time. As we move through our 50s, 60s, and 70s, our ability to recover from small stresses decreases. Muscles rebuild more slowly. Cartilage does not repair as easily. The systems that once compensated for poor posture, occasional strain, or extra weight become less forgiving. That means mild joint pain can move into moderate or severe pain in a shorter time span than it would have decades earlier. Many older adults move less because they are already uncomfortable. They sit more and walk less, thinking they are protecting their joints. In reality, this often accelerates the problem. Joints are designed to move. When they sit still, the fluid that nourishes them does not circulate as well. The surrounding muscles weaken. The body becomes deconditioned. What began as a minor ache becomes a more serious issue simply because the joint was not used. Weight also tends to creep up over the years. Even a small gain of 5 or 10 pounds can significantly increase the load on your knees, hips, and spine. That extra load, carried over thousands of steps each day, accelerates wear and tear on already vulnerable tissues. It is like adding a few extra books to a backpack that has already been worn for decades. Lifestyle patterns also contribute. Long periods of sitting, standing in one place for too long, wearing unsupportive shoes, or repeatedly using the same motions can all place chronic stress on the joints. When these patterns stack on top of age-related changes, mild joint pain has plenty of fuel to grow. I remember a woman who drastically cut back her walking routine because her joints began to hurt. She believed she was avoiding damage. After 6 months, her pain was worse. Her muscles had weakened, her weight had increased slightly, and her joints now had to work even harder. When we gently reintroduced movement, focused on strengthening, and adjusted her habits, her pain began to improve. Not because we did something dramatic, but because we stopped feeding the cycle that made her mild pain worse. Chronic, low-grade inflammation from diet, stress, and poor sleep also plays a role. Highly processed foods, sugary drinks, and long-term stress hormones can all create a chemistry inside the body that is unfriendly to joint tissues. This environment makes it easier for mild pain to progress into something more persistent. The point is not to blame yourself for these changes. It is to understand that there are reasons mild pain feels more threatening now. And once you see those reasons clearly, you can also see where your power lies. What happens if mild joint pain is ignored? If mild joint pain is brushed aside long enough, the joint gradually enters a different stage. Cartilage becomes thinner and more uneven. The joint space narrows. The bone underneath the cartilage may develop small changes that increase friction. The muscles around the joint lose strength and coordination. The result is often osteoarthritis, a condition many seniors know too well. As osteoarthritis progresses, pain becomes more frequent and more intense. Stiffness lasts longer in the morning. Activities that were once easy, like walking a few blocks or standing in the kitchen to cook, begin to feel like challenges. Some people describe their joints as feeling rusty or stuck. Others say they feel fine when sitting, but pay for it every time they start moving again. Mobility begins to shrink. Instead of going to the park, you might choose to stay home. Instead of walking through the grocery store, you might rely on delivery. Instead of joining friends for a walk, you might sit and watch from a distance. Little by little, independence erodes, not because you are weak or lazy, but because the pain has quietly taken control of your choices. There is also a very real risk of falling. When joints hurt, people naturally change the way they move. They may put more weight on one leg, hesitate when stepping, or avoid bending their knees fully. These compensations can throw off balance and increase the likelihood of slips and falls. For older adults, a fall is not just a bruise. It can mean fractures, hospital stays, and prolonged loss of confidence. Research has shown that ongoing inflammation and joint stress can accelerate cartilage damage several times faster in people who do not address mild symptoms early. In other words, the longer mild pain is ignored, the more rapidly the joint can deteriorate. This is not meant to frighten you. It is meant to emphasize that you have more power than you think, especially when pain is still in its mild stages. How to stop mild joint pain from getting worse? Now comes the hopeful part. Mild joint pain is a warning. but it is also an opportunity. When you respond early, you can slow, stop, or even reverse much of the progression. The key is to take gentle, consistent action in a few important areas. Movement is one of the most powerful tools you have. Your joints are nourished by motion, not by stillness. Simple, low-impact exercises can make an enormous difference. Gentle joint circles, slow leg lifts while lying or sitting, standing up and sitting down from a chair with control, and marching lightly in place can all help strengthen the muscles that support your joints and improve the fluid movement inside them. The goal is not to exhaust yourself. The goal is to remind your joints and muscles that they still have work to do and that they are still capable of doing it. Daily activity matters too. Short walks spread throughout the day, light stretching in the morning, and avoiding long periods of sitting can all protect your joints. If standing for too long hurts, alternate between sitting and standing. If walking long distances feels hard, break it into shorter segments. Listen to your body, but do not abandon movement altogether. Nutrition is another powerful ally. A diet rich in omega-3 fats from sources like fish or walnuts, plenty of colorful vegetables, berries, and whole grains can help calm inflammation. Reducing processed foods, sugary snacks, and excess salt supports both joint health and overall well-being. It is not about perfection. It is about creating a chemistry inside your body that is kinder to your joints. Certain supplements can be helpful for many older adults, especially when combined with lifestyle changes. Collagen type 2 may support cartilage. Glucosamine and MSM can aid joint comfort for some people. Vitamin D3 with K2 supports bone health, and magnesium helps relax tight muscles that tug on the joints. These are not quick fixes, but they can be valuable tools in a larger plan. Practical choices also play a role. Supportive shoes with cushioning and good arch support can reduce impact on the knees and hips. Using a handrail on stairs while you build strength is not a sign of weakness. It is a sign of wisdom. Taking breaks to move during long periods of sitting protects your joints from stiffening. And finally, it is important to know when to seek professional help. If mild pain is becoming more frequent, if it starts to limit your daily activities, or if you notice swelling, redness, warmth, or significant stiffness, it is time to talk to a healthcare provider. Early evaluation can reveal issues that are still manageable and give you a personalized plan for protecting your joints. The most important message I want you to take from all of this is simple. Mild joint pain is not something to fear, but it is something to respect. When you listen to it and respond with care, you give your body the chance to heal, adapt, and support you for many more years. In the final part of this video, we will bring everything together and talk about how to live with greater confidence, gratitude, and trust in your body, even if you have already been living with joint pain for some time. As we come to the end of this conversation, I want you to carry one simple truth with you. Mild joint pain is not your destiny. It is not a sign that your best days are behind you. It is a signal, a gentle nudge from your body asking for care, attention, and patience. And signals are meant to guide us, not frighten us. When you choose to act early, you give yourself the chance to stop small problems before they grow. You give your joints the support they have been quietly hoping for. And no matter your age, whether you are in your 60s, 70s, or 80s, your body still has an incredible ability to adapt and heal. I have seen it in my patients again and again. The human body, even after decades of use, still responds beautifully to movement, nourishment, and kindness. What matters most is consistency, not perfection. A few minutes of daily exercise, a mindful choice at the dinner table, a short walk instead of sitting a little longer, a moment of stretching before bed. These small actions build strength the same way a river smooths a stone, slowly but powerfully. With patience and gentle discipline, your joints can become steadier and more dependable than you might imagine today. Before we close, I want you to take a moment to thank your body. Thank the knees that have carried you for a lifetime. Thank the hips that have supported every step. Thank the joints that may ache now but have served you faithfully in ways you may have never acknowledged. Gratitude creates a different kind of healing, one that begins in the heart and radiates outward. If this message spoke to you, I invite you to stay connected. Like this video, subscribe and turn on the notification bell so you never miss our next conversation here on Senior Health Daily. We are walking this journey together, and your healthiest, strongest years can still be ahead.